So the PEG-PH20 is an agent that essentially modifies the fibroblastic, the desmoplastic reaction around the tumor, and it breaks through it in simple ways. And essentially, the thought is that if you break down that barrier, you will be able to enhance drug delivery. And the reason why these tumors are hypovascular is because of the dense desmoplastic reaction around the tumor. So if you actually break down that barrier, those vessels will pop up, will open up, and then you will get better delivery of chemotherapy and immune cells and other healthy cells. So the question is, clinically, at least in the first clinical trials, did PEG-PH20 show any signs of promise? So when you look at the unselected patient population, meaning across the board everyone gets treated, there's no improvement in outcome. However, when you go down to select those patients who express HA, so hyaluronic acid, at higher levels, those are the patients that seem to derive benefit from an approach that targets specifically that enzyme, so that protein. So at this point of time, at least from the early clinical work in patients whose tumor express at high levels hyaluronic acid, PEG-PH20 added to chemotherapy, standard chemotherapy, so gemcitabine, nab-paclitaxel, and there's another study with FOLFIRINOX plus PEG-PH20 will hopefully show some benefit. The larger study is the one that's selecting for patients. Started activating and has a patient on a couple of months ago. And that study selects for the high levels of HA, and the agent PEG-PH20 is combined to gemcitabine nab-paclitaxel versus gemcitabine nab-paclitaxel alone. That's a very interesting study because it essentially selects those patients who are more likely to respond. So hopefully, given the early promise of the early clinical results, that this will hold on as we move forward in a large prospective manner.
JAK-STAT pathway is well known in like hematological disorders, and that has been targeted by certain drugs, and the most known is the ruxolitinib. And if we go back to that pathway, it's also where the cytokines are working. The cytokines, we know in some patients are released systemically, and they also contribute to the systemic effects of cancer. And we know pancreas cancer patients, they can get a lot of fatigue, weight loss, and other symptoms, or even fever, and even other features like elevated white cell count, low albumin, which are features of like even having an infection. Sometimes they can be mistaken for an infection. So there was a good thought behind bringing in the ruxolitinib as a drug to be used in patients with pancreatic cancer. It may have anti-cancer effect, but it can also support the patients by minimizing those symptoms. And we know that the use of ruxolitinib in some disorders, hematologic disorders, really gets a rapid symptomatic improvement. So there was a clinical trial, pilot clinical trial, to look into ruxolitinib when it was added to capecitabine in the second-line setting. So patients who failed frontline therapy, again, mainly gemcitabine-based treatment. That trial was interesting because it showed benefit to patients who have elevated C-reactive protein. Now, C-reactive protein is a measure of the systemic inflammatory immune status, which made sense, biologically made sense. Patients also gained weight on it, so it was really interesting. So that went into a phase 3 trial. Phase 3 trial trying to now look in a larger number of patients, and that trial was stopped because there was no benefit seen with the drug. So targeting JAK-STAT pathway is now not a strategy that's being pursued by anybody.
So neciparinib is an agent that essentially is a heparinoid. It was built on the platform of low molecular weight heparin to essentially lose its anticoagulant activity, or most of it, and enhance its anti-cancer activity, because we've always known that low molecular weight heparins have some baseline activity against cancer. So the phase 1 study was, or is being presented at ASCO in combination with gemcitabine plus nab-paclitaxel, and the earlier study with gemcitabine alone. Did show some interesting results. The larger study, the phase 2 randomized study with gemcitabine, nab-paclitaxel plus minus neciparinib, is on track to be completed in the fall, and therefore we will have some preliminary results about this strategy added to chemotherapy versus chemotherapy, and whether it's worthwhile to move to the phase 3 setting. But again, if some of those early results hold on, there hopefully will be a path moving forward with this agent in pancreas cancer.